We are here with the current news that's very important regarding the coronavirus. What are the updates which we are getting? I'll be discussing here today. कोरोना वायरस का जो स्टेटस अभी है इंडिया में और पूरे वर्ल्ड में, तो उसी को लेके हम आज थोड़ा बहुत डिस्कस करेंगे. ठीक है. तो एज यू नो, मैं ऑलमोस्ट एवरी डे I keep you updating all of you regarding what is the COVID news in India, firstly in India and abroad. Okay, so I will give the references of the news because that's important thing. So firstly, let me go for a news 18 report that's today's news, that says like COVID surge packs hospitals OPDs, hoarse voice, watery diarrhea and fever common complaints. Please make this a note. Please make this a note. अगर आपका गले में खराश है या you are having some problem with your throat, या इसको बोलते हैं throat infection. Number 2, if you are having a watery diarrhea, along with the throat infection, you are having a watery diarrhea and fever. ये तीन चीज अगर they are matching with your health condition today, please make it sure you go immediately to a doctor for a check. So according to the experts dealing with the patients at hospitals, OPDs and admissions, the recovery period after infection is in most individuals in this current wave is reasonably short. So that's a very good news. That recovery rate, the time required for its recovery is very short. That suggests the infection, what is happening right now, is not that much dangerous. Is not that much dangerous. Okay. So COVID surge pack hospitals and OPDs, hoarse voice, watery diarrheas, and fever common complaint. These are the three problems that the COVID patients are facing right now. Please inform this with your friends and fellow mates. This is very, very important. COVID surge packs hospitals OPDs. Hoarse voice, number 1. Number 2, watery diarrhea. Number 3, fever. These are the common complaints which we are getting. Hoarse voice, throat pain, diarrhea, mild stomach cramps. Along with that, a mild stomach cramp and fever are currently the most commonly reported COVID-19 symptoms in hospitals and OPDs. While hospitals are not observing a significant rise in ICU admission, that means the virus is not that much dangerous right now. The virus is not affecting us that much now. While the hospitals are not observing a significant rise in ICU admissions directly attributable to COVID, there has been a sharp increase in OPD visit. So OPD visit is the most dumping, because dumping is happening over there. Over the past 10 days, the patient footfall has surged by 3 to 4 times, indicating noticeable uptick in the mild to moderate cases. This is a very good news for all, that the COVID-19 situation, the coronavirus which is affecting us right now, that is actually the Omicron variant, is not that much affecting to your population. Maybe it is spreading like anything, it is increasing, it is spreading, but the effect is very short and mild. Currently circulating variants That's important. Primarily JN1, NB181, and LF7. All sublineages of Omicron. All are the sublineages of Omicron are associated with high transmissibility but relative mild clinical manifestation in general population. That's a very good news. All the variants are from Omicron. So due to its nature, transmissibility, that it will spread very fast. It will spread very fast, but the clinical manifestations are found, which are found in the general population, are very mild. However, the individuals with underlying health conditions such as underlying health conditions, please make it a point, underlying health conditions like diabetes, chronic respiratory illness, or compromised immunity, as well as the elderly and young children, may remain at elevated risk. This is very important. I repeat, diabetes, chronic respiratory illness, or compromised immunity, as well as the elderly and young children, may remain at elevated risk. So, if you have kids in your home, keep them safe. If they're going to school, ask them to use nose masks, use the sanitizers, try to keep them, maintain a social distancing, avoid going to the crowds. That's the only suggestion which can be given and is being given by the doctors. As for the doctors concerned, as they say, at present we are not seeing a surge in ICU admission. That's a very good news due to COVID-19 directly. However, we are witnessing a marked increase in the OPD footfalls, with patients visiting increasing by nearly 3 to 4 times in the past 10 days. So that's the thing. As per the News 18, there is a noticeable sense of panic and heightened health vigilance, especially among individuals with existing comorbidities, senior citizens, and parents of young children. That's true. You have to be precautious. When you have your small kids, just try to keep them away from the crowded areas. When they are going outside with you, try to use a nose mask. Try to use frequent sanitization of your hands, and always avoid eating or gathering outside to a maximum possible condition. So this is one news that is from TV8 News 18, which says COVID surge backs hospital OPDs along with hoarse voice, watery diarrhea, and fever as common complaint. So this is one of the news of today. I do have other newses also, so keep yourself touch with me. So next news I have for you, which is very important news for you all regarding COVID-19. It says, so COVID-19 news, current news from Money Control. I have from Money Control, which is suggesting over here. Okay, the news is COVID-19 in India live update. Chandigarh reports first COVID death. Cases soar across India. Cases soar across India. But don't panic. As I told, there is nothing to panic. Serious cases, the death reports are occurring has occurred with very serious cases only. COVID-19, a disease we first heard in 2020, after which it went on to create havoc all over the world, has now resurfaced. After China, Hong Kong, Singapore, and other places recording an uptick in COVID-19 cases, India is now on the same page. Several places including Maharashtra, Kerala, Tamil Nadu, Karnataka, Delhi, and Punjab, has recorded a new coronavirus cases in last few days. So that's a very important thing, a very important news. So what's the COVID-19 update right now? What are the symptoms? I told you the main symptoms. Okay, bye. So name main symptoms what is there right now are throat pain, diarrhea, mild stomach cramp and fever, which are occurring commonly in COVID-19 symptoms in various and is reported in various hospitals and OPDs. There is another news on COVID-19 in India. Karnataka man dies. So in Karnataka, an elderly man dies who tested positive with COVID-19 at a hospital in Belagavi district. A senior official in the health department reported. The patient who was a 70 years old man died due to acute cardiorespiratory arrest with encephalopathy and late onset seizures associated with diabetes, hypertension, ISD, and positive status of COVID-19. So the current report on COVID-19 cases rise in Karnataka also. Karnataka reported a record of 40 new infections in May 28, taking the active tally to 126. The state positivity rate rose to 10.12% with only 395 tests conducted on May 28 within just that much. So it is spreading. As I told you, the COVID-19 is spreading like anything, as it is the nature of Omicron virus. It's the nature of Omicron virus that it is showing its effect. It will spread. It will spread. But there is nothing to panic because its effect or the virulence is not very high. You may say it's having an effect, or you may get an effect of a serious cold or flu like symptoms, which involves your sore throat, your GI disturbance along with fever. Another case report from COVID-19 from Chandigarh records his first COVID-19 death. As I told, a 40 years old Firozabad native died following testing positive for the virus. So COVID-19 in India live updates. Experts warns for vigilance as the case rises. According to CNBC TV 18, experts have warned and urged the people to be vigilant as cases in India are now rising. Health experts remind us that the virus is still around, but mostly causes a mild illness and hospitalization rates remain low. That's important thing. The hospitalization rates are low. Authorities are vigilant, tracking the new subvariants and mutations with a genome sequence. CNBC TV 18 reports that. So that's what we are getting updates in every moment. So another news I have got, that is from Mint 2 hours ago. So I have another important news to share with you all from Mint. It says low vaccine stocks in focus as new COVID variant spreads. The vaccine issue is a very essential issue, and it reports that there is a low stock of vaccine that is being reported, and there is an upsurge of this low vaccine stocks in focus as new COVID variant spreads. So this is a New Delhi report. As COVID cases rises in India amid low vaccine stock. Oh my God, the vaccine stocks are low right now. Of course, because for a long duration of period of time we didn't face this virus. So there may be a low stock of these vaccines. This has not been produced for some time. So the stock is less. The center has set up a committee to review the situation and ensure that the country is ready to manage the unfolding situation. The panel constituted by Health and Family Welfare Ministry met earlier this week and last week to discuss the COVID preparedness, including low vaccine stocks, surveillance, testing, beds, and medicines, said the two people familiar with the matter, speaking on the condition of anonymity. The committee of the nation's top scientists and officials called for keeping surveillance strong, increasing pace of testing, and putting on adversaries, said the two people. So, as a precaution, हमारे जो country Ministry of Health है, they are taking steps like they are increasing the pace of testing. जहाँ जहाँ advisories डालने का, they are keeping the advisories. There are 3 to 4 states where the advisories are issued. Panels also reviewed COVID-19 vaccine stocks in view of vulnerable and high-risk populations, including the elderly people with comorbid conditions, and recommended augmenting the number of beds and medicines in the hospital, the official said. The meeting was attended by officials from Directorate of Ministry General of Health Service, DGHS, National Center of Disease Control, NCDC, and Indian Council of Medical Research, ICMR. Queries emailed to the Health Minister JP Nadda's office, Health Secretary Punya Shalila Srivastava, and Health Minister spokesperson on May 28 remained unanswered till press time. Department of Biotechnology, that is DBT, and other government laboratories are conducting environmental surveillance, collecting and analyzing sweat samples to understand the latest COVID-19 surge in Delhi, Mumbai, Pune, and Kolkata, along with Ahmedabad and Bengaluru, are seeing the spike in the new COVID patients. India has reported around 1,000 active COVID cases till 26th of May, with 7 people succumbing to the infection. They died. However, the health ministry is yet officially confirm the mortality numbers. But अब पकड़ लीजिए कि ऑलमोस्ट 6 से 7 डेथ हो चुके हैं. But along with the other informations, जैसे मैंने बोल चुका हूँ, the work is on. The researchers, the scientists are working together with the manufacturers. Serum Institute of India and Bharat Biotech manufactured billions of doses of vaccine for India and for supplying to 100 countries during the first wave of the pandemic. However, after that the situation eased. The last COVID vaccine batches were manufactured a year ago with no visibility on new stocks. So currently there is no stock of vaccine right now, but we actually in the need. So probably right now the virus looks very mild. We are tracking the number of COVID-19 cases and hospitalization happening across the country and alerted all the laboratories, said the same government official. We have discussed COVID-19 preparedness measures and other surveillance strategies. So right now COVID-19 का जो vaccines है वो last year ही बना है. Currently fresh stock of vaccines available नहीं है. That's a thing right now. So there is nothing to get panicked. There is nothing to get panicked on that. Right now, even though there is no vaccine stock available, but still this can be used. There is advisories given for the manufacturers to speed up the vaccine production also, and they are targeting mostly the vulnerable population, like elderly people or with the patients with comorbidities, as the conditions and the reported cases are very, very mild. So this is what I have, the current information regarding the COVID-19 news. Let me go for other if there is anything. So let me get a world news. I'm hereby showing you a world news related to the COVID-19 that is published today under the news of Business Standard. So hopefully, please stay with us. India, Thailand, Singapore seek a upstick in the COVID cases. WHO urges vigilance. This is a fresh news for today. So it says India and several Asian nations are witnessing a renewed spike in COVID-19 cases, promoting government to review health infrastructure and issue precautionary advisories, while the World Health Organization has reported a global crisis in infection. Authorities in India and countries like China, Singapore, and Thailand are stepping up monitoring efforts, especially with newer sub-variants of Omicron. As I told, there are 1,000 cases that are being reported in India, and the researchers are really working hard on it here along. So in the China, strong COVID-19 variant is observed in China. China's Center for Disease Control and Prevention reported a positivity rate of 15.8% from selected hospital tests in early May, up significantly from 6.3% at the end of March. In April alone, the China lost over 16,008. I'm sorry, it's 1,68,000 confirmed cases, including 340 severe ones and 9 deaths. So that's a big news. China is suffering very hard by COVID-19. They have a total case report of 1,68,000 confirmed cases, and they're including 340 severe ones. Their 340 cases are very, very severe, with total of 9 deaths. So if you consider the infection and the death, the ratio is very high. So you should not get much panic unless there are precautions to be taken for the vulnerable population. So please, if you have someone who are vulnerable, keep them stay there, let them be at home in isolation. In Thailand, oh my God, in Thailand, over 1,80,000 cases are reported in Thailand. Thailand has recorded 1,87,031 COVID-19 cases and at least 44 deaths for the January to mid-May, the National Thailand reports. A total of 67,484 new cases and 8 fatalities were recorded over a period of this week, with Bangkok leading in numbers. The annual Songkran Water Festival in April was being blamed for this spread. So that's the thing. There was a festival in Thailand where there is a conglomeration of a lot of people happening, and that was what was the main cause for this death reporting. But in India, of course, the same thing happens. We just came to know about this COVID-19 in a very high upsurge, but don't worry, as I told, it is being reported normal. Okay, so that's what the reports are saying. The COVID vigilance is on, and the things are in control till now, especially in India. So try to keep yourself safe, be safe at home. That's all. That's the news regarding COVID for today. Thank you.